wonderful work in the area of heart care awareness and as well as the delivery of care. Dr. Agrawal, you heard Dr. Gangadhar saying about the response of the government and then the response of the society. Dr. Nagarkar also has highlighted very well that despite there was some kind of fear initially, with the right kind of training resources and the management and also appreciation, they have been able to deliver good results so far. The entire event is about appreciation. We are here to appreciate the work of our healthcare professionals and doctors. But when they are working in these challenging time, definitely they expect much more from the system, from the public, and from their colleague. Dr. KK Agrawal, I would like to have your keynote address on that. That where do we stand there, and how, as a nation and as a society, we need to stand with our healthcare workers.
Thank you, Kamal, and thank you, other colleagues sitting here, Dr. The results to the patient's immunity and the patient's destiny. So our job is to heal. Very rarely we as a doctor gets an opportunity like an army man. He always looks for an opportunity to fight in the battle. This opportunity has come to all the people in this generation to handle a pandemic, a new disease. Nobody knows what it is. Unfortunately, China never shared their experiences with others. So therefore, Iran had to learn of its own mistakes. Italy had to learn from its own mistakes. US is learning from its own mistakes. Europe learns from its own mistakes. And in India also, we are learning from our own mistakes. We are better prepared because we have seen mistakes of others. But even then, we will say, even we did mistakes of not declaring a lockdown on 31st of January when the first came in India. Doing a lockdown on 22nd of March, we had enough cases in the country. Therefore, now we cannot stop. So everything was evident and it was oncoming. We were only delaying things. Now today, we have learned a lot. Indian coronavirus is different from the Western coronavirus. It is different from other coronaviruses. It's different. In Europe and in US, we are seeing an inflammatory response in children. In India, we are seeing a post-COVID inflammatory response in everybody, the adults. India is basically having a post-COVID inflammatory response. So if I want to simplify a few facts, based on my experience of over 2,000 patients which I've handled in the last 1 month, one experience is that in children, mortality is hardly any. In women, the mortality is hardly any. There are two types of stages of corona. One is a COVID phase, one is a post-COVID phase. I define a post-COVID phase after 9 days when the virus becomes non-replicative, because as on today, we have no evidence that the virus multiplies after day 9. Therefore, in the that is the COVID phase, we divide them into 3 phases: first 3 days, middle 3 days, and the last 3 days. The middle 3 days are the ones which are serious, specifically for the pulmonary COVID. So if you have congestion in the chest, and if you develop a ground glass opacities in your lungs, and if you develop pneumonia, this is the time when you diagnose early. You can get happy hypoxia, you can get ARDS, you can get anything. Therefore, at the onset of a pneumonia, if you give them an intravenous antiviral drug, or with steroid, with any other anti-inflammatory, and if you give them at particular motion, if you give them a low molecular weight heparin, you will be able to save them. In a post-COVID phase, which is after 9 days, before in the COVID phase also, you have extra pulmonary manifestations. That means a patient may come with diarrhea, with cystitis, with right iliac inflammation in the right iliac fossa. They may come with loss of smell, loss of taste. All these are normal. They are all going to go away. They are non-serious. So the only serious is day 4, 5, and 6, and that is pulmonary COVID. Next comes is a post-COVID phase. After 9 days, COVID is gone. The virus is gone. The virus is non-replicative. Now you have a post-COVID 2 things. One, sequelae of what damage has occurred. That means a person may have a post-COVID bronchitis, a person may have a post-COVID irritation in the throat, and then comes this persistent inflammation. So after 9 days, if you find out of 4 parameters, which is ESR, CRP, ferritin, and LDH, if 2 of them are positive, you call them as a post-COVID persistent inflammation, like we see a persistent inflammation of arthritis in chikungunya. So therefore, now we treat them as a post-COVID persistent inflammation. They may have persistent fever, they may have persistent diarrhea, they may have persistent cystitis, they may have persistent inflammation in the right iliac fossa. So this is a post-COVID persistent inflammation stage. It may require a short course of steroid, hydroxychloroquine, colchicine, or NSAID. So this is what we are learning. I'm going to end by making 2 bold statements, that it is very difficult to die because of COVID. You literally have to work hard in dying because you will have to ignore so many things to die. There are enough signals for you to save yourself. Mortality is an exception, not a rule. Recovery is the rule and not an exception. This is as on today, 2nd July of 2020. This may not have been true 15 days back. This sentence may not be true after 15 days. After 15 days, we may say 0% mortality. But as on today, yes, this virus mortality with adequate and effective and early treatment, nobody should die. Thank you.
Sir, thank you so much for describing this so well. And then it is very interesting to hear that you really need to work hard to die of COVID. But I want to also know from you that what you feel for the entire healthcare community, what you said that they have got this lifetime opportunity of being a warrior. But are these warriors, adequately equipped? Are we standing with them? You have seen that.
Kamal, I am saying is that an opportunity was given to Ayurveda to come forward. They lost the opportunity. An opportunity was available to homeopath to come and become the frontline treatment-oriented people. They haven't come forward. An opportunity was there for everybody, and still the opportunity is. I have narrated what we need. At this moment, we need a drug to post-inflammatory, post-COVID inflammation. Let anybody come back and say. I'm very clear in saying is that we don't require hospitalization except when you need a ventilator. Therefore, infrastructure we don't need. If you are going to fill up the hospitals with patients, you are going to cross-infect the healthcare workers. So healthcare workers should manage only those patients who need a ventilator. If you need an oxygen, treat them at home. Home care and telemedicine care are the 2 achievements of COVID. Treat everybody at home, let the doctors be there, let every private doctor be involved, let every nurse be involved. Treat patients at home, give them full care, and let the doctors treat only patients who require a ventilator care. Make all oxygen concentrators available at home. You will require no infrastructure, because what is happening is by admitting these patients who don't require admissions, you are affecting the non-COVID care. A time will come, non-COVID patients will start dying because they are not getting the beds. So why should we? There should be a selected 2%, 3%, 4%, 5% who need ventilators. Let them be treated. Let all others be treated like a non-COVID emergencies are there. People are not touching them. I have patients who are lying with they said, I need a surgery. A doctor says, no, 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 and no. So non-COVID patients are getting absolutely ignored. Your COVID patient should be managed at home. I'm very clear about it.
Thank you so much, sir. So this is very important message that COVID patients should be taken care of as much as possible within the 4 walls of home, and which is much better for them to recover faster, I think also. And also it is going to help the entire healthcare system to focus on something which is of higher emergency, and so that no one is dying of heart attacks or strokes or any other major issues or cancer, which are we are seeing the patients suffering because of this whole fear created around COVID-19. So thank you so much, Dr. Agrawal, for your time, and also Dr. Nagarkar for your kind time to join us on this inaugural session of day 2 of Gratitude Week. We place our heartfelt regards to all our healthcare workers, people like you, Dr. Nagarkar, Dr. Gangadhar, Dr. K.K. Agrawal, and millions of others who are working at every stage of healthcare delivery. And we will go forward to now playing our anthem, which has been created especially for in the respect of our doctors, and we'll also see some of the gratitude messages have come from the children from across the country. So over to my team to play the anthem song.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात, परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया।